My name is Leonie Powers. The name of the paper is Reclaiming Traditional and Indigenous Postpartum Care Traditions as an Act of Remembering and Revolution. Phrases like psychological warfare and act of revolution are not often applied to the maternal continuum. I know. However, an examination of the current state of maternal health in the United States would show racial disparities resulting in maternal and infant mortalities and morbidities, socioeconomic pressures to return to work and pre-baby body standards very quickly, and to perform parental tasks and goals unassisted, because the village that was supposed to help you raise the child just isn't there. On paper, those results read as an emergent state of distress. These dynamics are a form of psychological warfare shown by the increasing rates of postpartum mood disorders and postpartum mortality rates, particularly among minority women. I know, when you hear the term or phrase psychological warfare, it sounds really heavy, but if you look at the definition, it tracks. The use of propaganda, misinformation, and other psychological tactics to influence behavior or beliefs. Psychological warfare includes efforts to manipulate an individual or group's emotions, perceptions, and thought processes to gain an advantage. It can take many forms, including the spread of false information, the use of fear and intimidation, and the manipulation of media and public opinion. Psychological effects of information and messaging can be as powerful as a physical force. So, it's applicable. Today, we will examine how the integration of traditional and indigenous practices into postpartum care can change the dynamic and would benefit all birthing people as well as the healthcare system. It would be a revolutionary shift in the approach of postpartum care, calling for a return to a more holistic and culturally sensitive one that prioritizes the health and well-being of birthing people and their families. So what are these practices? Traditional knowledge refers to knowledge passed down through generations, but not necessarily derived from indigenous communities, where indigenous postpartum care refers to the traditional practices and rituals surrounding the period following childbirth in many indigenous cultures around the world. While traditional knowledge and indigenous knowledge differ, they do have similarities. Both are grounded in practicality, developed through custom and tradition and based on experience, and centered on a holistic understanding of the world. These practices are intended to promote physical, emotional, and spiritual healing, which results in overall well-being. Indigenous communities around the world have rich traditions of postpartum care, involving a variety of practices. For example, the Aboriginal communities in Australia may seclude a mother and baby for a period of time to allow for rest and bonding, while performing a smoking ceremony to cleanse negative spirits. In North America, Indigenous women may participate in sweat lodge ceremonies to promote healing and purification, as well as smudging to cleanse negative spirits. Similarly, in South America, a massage using special herbs and oils are used to aid in healing and bonding between the mother and child. In New Zealand, Maori culture incorporates the use of woven flax cloaks to provide warmth and protection. Mesoamerican traditions involve a 40-day rest period of recovery for birthing people, with ceremonies such as closing the hips to promote optimal healing. Aboriginal and Native Indian cultures also have a postpartum care period known as the sitting month, during which the birthing person abstains from work and other responsibilities and is cared for by family members. The Golden Month in China and traditional Southern Black midwifery in the United States emphasize nourishing foods, rest, and community support for the birthing person. These practices all center on the idea that the person needs to be cared for and supported in order to fully recover from pregnancy and childbirth and to adjust to the demands of new parenthood. The importance of ritual and the ritualistic use of plants for botanical support are often interwoven into these practices, providing a holistic approach to postpartum care. A major point of contrast is that in many Indigenous communities, childbirth is viewed as a spiritual and cultural event, not just a medical one. Ritual is intrinsic to human nature. It is an important aspect of the human experience that has been present in various forms across cultures and throughout history. A key function of ritual is to provide a framework for understanding one's place in the world and relationship to others. It allows a connection with one's ancestors, community, and spiritual beliefs, and rituals mark important life transitions such as birth, puberty, marriage, and death. They can be as simple and solitary as someone decorating their Christmas tree, or as elaborate and communal as a high school graduation ceremony. This sense of continuity and connection is considered crucial in many communities to maintain a sense of identity and belonging. They provide a sense of transcendence and connection to the divine, as well as a space for reflection and contemplation. In this way, ritual can serve as a form of therapy by helping to process difficult emotions and life-changing experiences. In addition to its spiritual and psychological effects, ritual also has practical applications for one's welfare. For example, many postpartum care traditions involve specific rituals designed to aid in physical recovery and to promote bonding between mother and baby. Some examples. A 2020 study found that using a blend of red raspberry leaf and nettle leaves were effective in reducing postpartum bleeding and also improving iron levels. Native and First Nation women have used this in postpartum care as botanical support for centuries. Studies in 2020 and 2019 found that the practice of belly binding was associated with reduced abdominal muscle separation, improved posture, and reduced pain and improved physical functioning in postpartum women. It also improved breastfeeding self-efficacy and duration. The study also showed a reduction in postpartum depression and anxiety. Women in Africa, Mexico, and Southeast Asia have practiced belly binding for centuries. Another study in 2017 and 18 found that the Mesoamerican Indigenous ceremony of closing the hips or bones was associated with improved mood, decreased pain, and increased relaxation in postpartum women. It also found improved pelvic floor function and reduced pelvic pain and reduction of symptoms of anxiety and depression. Studies in 2018, 19, and 21 found that the use of the rebozo, a long woven shawl used for centuries, used by midwives in Mexico and Central America, resulted in a significant reduction in pain, shorter labor duration, and decreased the need for interventions or complications such as postpartum hemorrhage. In 2014, a study found that the use of herbal baths and teas by Southern Black midwives was associated with improved maternal and neonatal health outcomes, including reduced rates of infection and faster healing of perineal tears. Another study in 2005 examined the use of mother roasting by Southern Black midwives, which involved placing warm cloths or heated bricks on the mother's abdomen and back after childbirth. The study found that this practice was associated with reduced postpartum bleeding and improved overall well-being of the mother. The studies referenced in this paper suggest that a holistic and supportive approach to postpartum care, one that honors the mother's physical, spiritual, and emotional needs, can have numerous benefits, including maternal satisfaction, improved mental health outcomes, and reduced rates of postpartum depression and anxiety. It can also lead to better breastfeeding outcomes and improved bonding between mother and baby. These traditional practices, such as the use of herbs and massage, have been shown to have physical benefits, such as reduced inflammation and pain. Overall, the studies support the idea that postpartum care should not just be a physical recovery, but should also prioritize emotional and spiritual well-being. Society stepped away from traditional midwifery and turned more towards the medicalization of childbirth during the late 19th and into the 20th centuries. With the emergence of modern obstetrics, there was a growing movement to professionalize the practice of childbirth and bring it under the control of trained medical professionals. The medicalization of childbirth on minority and indigenous communities yielded various results. Medical interventions proved beneficial, leading to an improved maternal and infant outcome. However, the medicalization of childbirth also yielded negative consequences, including an expose including discrimination, the loss of traditional birthing practices, and cultural disconnection. In many communities, the pendulum swung too far. For African American women in the United States, the medicalization of childbirth has been linked to higher rates of maternal and infant mortality and morbidity. Research has shown that African American women are more likely to receive substandard prenatal and postpartum care and to experience medical interventions during childbirth, such as induction, episiotomy, and cesarean sections. These disparities have been linked to a complex set of economic and social structures, including racism, discrimination, and bias within the healthcare system. According to the Centers for Disease Control and Prevention in the United States, the pregnancy-related mortality rate in 2018 was 17.4. The rate was higher for Black women, coming in at 44.5, and American Indian, Alaskan Native women experienced a rate of 29.7, compared to white women who had a rate of 13. Racial disparities in birth and postpartum are a significant issue in the United States. Black women are 3 to 4 times more likely to die from pregnancy-related causes than white women. Additionally, Black women are more likely to experience complications during pregnancy and childbirth, including preterm birth, low birth weight, and preeclampsia. The reasons for these disparities are complex and multifaceted, including systemic racism, implicit bias, and inadequate access to health care. The decrease in infant mortality after medicalization of childbirth, paired with the positive results of traditional care referenced by the above studies, leads one to infer that by combining modern health techniques and traditional holistic care, a positive synergy can be created. This synergy would effectively contribute to closing the gap between the biomedical and holistic approaches to postpartum care existing today, especially in many marginalized communities. The lack of a cultural and holistic approach in the current maternal health system can have negative effects on all women, regardless of their race or ethnicity. However, it is important to note that women of color, including Indigenous, Black, and Latinx women, are disproportionately affected by systemic inequalities and bias. Even women of European ancestry can be negatively impacted by the absence of holistic and cultural perspective in maternal health care. The cultural biomedical model often focuses solely on physical health and may not take into account the emotional and spiritual needs that women need during this transformative time in their lives. The medical model of childbirth has historically centered on individualized care, often prioritizing the needs of the medical system over those of a single birthing person and their community. Another source of negative postpartum pressure is hustle culture, the glorification of overworking and sacrificing personal needs for productivity. The amount of time that the average woman takes for maternal leave in the United States can vary widely depending on a number of factors, including her job, employer, and personal circumstances. According to the data from the Bureau of Labor Statistics, as of March 2021, only 21% of U.S. workers had access to paid leave through their employer. Maternity leave has been a topic of contention in the United States for many years, with debates around the issue dating back to at least the early 20th century. In 1919, the Women's Bureau of the U.S. Department of Labor recommended that women be given a minimum of 4 to 6 weeks of paid maternity leave, but this recommendation was never implemented at a federal level. Reclaiming traditions for postpartum support can help counteract the negative impact of hustle culture by promoting rest, self-care, and community support for new mothers. So what does reclaiming mean? Reclaiming traditions for postpartum support is in reference to the revitalization and integration of cultural practices that have been passed down through generations into modern-day birth work. By reclaiming these traditional birth rituals, communities are asserting their sovereignty and challenging colonial legacy. This act of revolution seeks to restore autonomy and self-determination in the realm of reproductive health and challenge its systemic oppression and marginalization that has historically infected the healthcare system. What are the challenges? This shift requires a recognition of the importance of traditional wisdom, cultural practices, and community-based care, as well as an integration of these principles into the dominant medical model of childbirth. There is a need for culturally competent healthcare providers, access to resources and education, and recognition of the impact of assimilation on those culturally on those cultural practices, and the recognition of the impact of assimilation on those cultural practices. It is essential for healthcare providers to recognize the value of Indigenous traditions and work collaboratively with women and their families. But many people and providers may not know how to approach integrating elements of holistic Indigenous care into their practice. One topic of tension is the subject of appropriation. There is a long history of practices and traditions of marginalized cultures being either demonized, excluded, and then later being co-opted and appropriated. Currently in Mexico, the appropriation of traditional midwifery practices in private hospitals is a poignant example of how cultural appropriation can result in the erasure of Indigenous knowledge and practice. Ironically, in many poor Indigenous communities where these techniques have been used for centuries, traditional midwifery is being prohibited. But the practices and rituals are being offered at high-end private hospitals. This limits access and creates a dynamic in which natural birth is becoming too expensive for the poor. This has been further enforced by the government, which provides stipends to the poorest quarter of the population under the condition that the pregnant women give birth only in government hospitals. Removing the midwife and rebranding their practice is appropriation. To prevent the erasure of traditional knowledge and practice, it is essential to recognize and support the contributions of traditional midwives and to integrate their practices into modern healthcare systems, rather than just replacing them. Observing Indigenous practices without culturally appropriating them requires a deep respect for the cultures from which these practices originate, a willingness to learn and understand the cultural context in which they exist, and a commitment to honor and acknowledge those roots. The integration of Western medicine and Indigenous cultural traditions in obstetrics and gynecology would require a commitment to cultural sensitivity, partnership and collaboration, community involvement, education and training, and research and evaluation. By working together, healthcare providers and Indigenous communities can create a more inclusive and effective healthcare system that promotes the health and well-being of all women. So it is a challenge, but it's definitely worth it. Some specific benefits of including traditional postpartum care practices include reduced rates of postpartum depression and anxiety, improved breastfeeding outcomes, enhanced maternal-infant bonding, decreased risk of pelvic organ prolapse, improved pelvic floor health, and an increased support and connection within the community. Adopting respect for these practices can turn into better patient health outcomes for providers and more clientele across demographics for hospitals. Additionally, honoring and valuing diverse cultural traditions can promote cultural awareness, appreciation, and understanding, and can contribute to a more equitable and just healthcare system. Additionally, honoring and valuing diverse cultural traditions can promote cultural awareness, appreciation, and understanding, and can contribute to a more equitable and just healthcare system. Women can incorporate these Indigenous practices themselves into their birth experience, depending on their personal preferences and the availability of resources. They can seek a midwife or doula who is familiar with Indigenous practices and connect with a community or elder. Many Indigenous communities have cultural resources available for pregnant women, such as birthing classes, traditional healers, or support groups. Women can incorporate practices such as placenta encapsulation, herbal baths, or massage into their postpartum care routine. So does this call to action meet the criteria for an act of revolution? I know it's another one of those heavy phrases, but again, it's applicable. An act of revolution refers to a significant and often violent upheaval or overthrow of an established political, social, or economic system by a group of individuals or a population in order to bring about significant change. Revolution is typically characterized by the use of force or mass protest, but this paper argues that decolonizing and changing conversations across the maternal health continuum is just as effective in being the catalyst to prompt the replacement of existing power structures with new ones that are perceived as more just, equitable, or responsive to the needs of the people. Acts of revolution, of course, do include armed uprisings, strikes, and protests, but also civil disobedience and other forms of mass action aimed at bringing about significant societal change. In this light, even the simple act of educating and advocating for a holistic and connected birth is revolutionary. The reclamation of traditional and Indigenous practices in postpartum care is an opportunity for individuals and communities to reconnect with their ancestral knowledge and traditions while challenging the dominant Western medical paradigm that often overlooks or dismisses non-Western practices. By embracing these practices, we honor the wisdom of our elders and ancestors and create a pathway towards greater health and well-being for ourselves and future generations. This is not just about individualized self-care, but about collective healing. Acts of revolution bring about significant societal change. We invite you to join in this revolutionary journey. This is not just about individual self-care, but about collective healing. Thank you.